Welcome to this presentation of Magnetic Mallet. Magnetic Mallet is the most innovative surgical device able to improve working standards in sinus lift and split crest practices. Thanks to Magnetic Mallet, you will avoid having applied forces influence the whole craniofacial bones of the patient. You will no longer encounter problems of distress for the patient, causing dizziness, vertigo, nausea, also known as benign paroxysmal positional vertigo, due to the displacement of the otoliths in the inner ear. In this way, the surgery practice takes place in a shorter time and recovery for the patient will be much faster. Another advantage is to limit bone milling. Now, the advantages of Magnetic Mallet compared to the manual hammer in the osteotome practice. We used a simulator representing the craniofacial mask with its jaw and some spheres simulating the inner ear otoliths. The bottom structure springs react like the neck of the patient. The hammer is handled by the right hand, and consequently, the osteotome must be held by the left one, provoking a certain difficulty positioning the osteotome in the site. Giving the hit with a hammer, the craniofacial mask is totally affected by the impact, and the spheres are heavily diverted. Using the Magnetic Mallet, the spheres remain in place as the craniofacial mass is not affected by the impact. But why do the spheres stay in place when using the Magnetic Mallet, while when using a manual hammer, they're diverted? In the tests we conducted using the manual hammer, we got pulses of 40 decanewton and a duration longer than 300 microseconds. With the Magnetic Mallet, we can have 4 different forces applied in relative timing of application, going from 65 decanewton applied in 100 microseconds to 260 decanewton applied in 110 microseconds. A much higher force applied in a very short time influences only the bone mass on which the doctor operates. Magnetic Mallet is suitable for atraumatic sinus lift, flapless, implant placement, abutment extraction, root extraction, and split crest. Using Magnetic Mallet, the doctor has better visibility in the surgery practice, using just one hand for both handpiece and osteotome. They can easily insert the implant thanks to the specific implant housing and improve and simplify the split crest thanks to the special cutter. Meta Ergonomica designed a magnetic dynamical handpiece powered by a control unit, delivering preset forces by timing of applications. The osteotome is firmly hooked up in the instrument, and the application time of the force is the best one to achieve the desired plastic deformation. The device is designed to apply 4 forces of different strengths, and the handpiece is operated through its ergonomic foot switch. If needed, it can also be operated by the manual button placed on the power supply. The handpiece can be easily placed in its housing during the various steps of the surgery. In the specific Magnetic Mallet kit, you'll find the power supply, the Osteotome Function Handpiece. The Foot Control. A 10-instrument kit containing 10 different osteotomes: 1 mm, 2 mm, 3 mm, bone expander for bone expansion and compressions, 2.3, 3.3, 3.6 mm bone expander for the implant site diameter expansion, the beaver for the initial cutter of the bone crest, the cutter for the bone expansion technique, the extractor for roots and abutment extractions, and the new concept inserter to easily insert the implant. All the surgical instruments, except for the beaver and the extractor, are laser marked to show the difference in depth. This will make the check easier during the surgery practice. The standard kit also includes 1 spare silicone cap with 1 spare ring nut, 2 wrenches, a container with 2 blades, and an instruction for manual use. But there are tools on demand too. A double-bended version of the standard instruments designed to favor the surgeon getting into the inner part of the maxilla or to the lower jaw. Instruments are available both in the autoclavable container and also separately. And the latest optional instrument, a 1.6 mm bone expander for bone expansion and compression. The new instruments for roots and abutments extraction. A further evolution of the magnetic mallet is the crown remover handpiece, suitable to remove crowns and bridges. The handpiece operating is the same one as the osteotome handpiece, but the power is applied in reverse mode. With the crown remover handpiece, you obtain the deformation and the breaking of the retention cement and the consequent loosening of the crown or the bridge to be removed. The crown remover handpiece is supplied in its kit with a container and 3 which can be sterilized by autoclave. Using magnetic mallet, you can get an easier and faster surgery, working better and saving time. Have less traumatic operations for your patients because it doesn't affect the craniofacial mass. Use a flexible device for different purposes thanks to its versatility. Obtain a more rapid path to recovery for the patient. Magnetic mallet. Implantology rises to simplicity.